So in our previous year NEET question discussion series, today we will discuss 5 questions from NEET 2025 from the Department of Cardiology. Okay, so let us solve this question. Always when you are solving a NEET question, we have to read from the last line. So the last line reads as, what is the most appropriate initial management? So we have to read the first 3 lines to find out what is the diagnosis, and we have to think of the management. A 64 years old male presents with palpitation and an irregular pulse. He presents within 2 hours of symptom onset and has no history of diabetes or any other comorbidities. So let us decode this question one by one. A patient is presenting with palpitations. The clue given here is he has irregular pulse. So only one condition produces irregular pulse, which is atrial fibrillation. So this is a 64 years male having atrial fibrillation. And the next clue here is the onset of symptom is less than 2 hours. And he has no history of diabetes or other comorbidities. So why this is important is, as you all know, by the cause we can classify atrial fibrillation into valvular atrial fibrillation and non-valvular atrial fibrillation. By the duration again, atrial fibrillation can be classified in different ways. It's an acute atrial fibrillation, persistent and chronic. So we are not discussing the time durations. When the onset is less than 48 hours, it is usually called as acute atrial fibrillation. More than 48 hours to 7 days, it is persistent. So this is actually an onset is only 2 hours. So it is an acute non-valvular AF, because they are given the onset is 2 hours and he has no other comorbidities. So we are having a case of acute non-valvular atrial fibrillation. So what is the most appropriate initial management? So if you think of the management of atrial fibrillation, it is of 3 steps. And the 3 steps come in order. The order is rate control, anticoagulation, and rhythm control. Rate control, anticoagulation, and rhythm control. So the first step which we have to do is rate control. So rate control, just think of the mnemonic ABCD. Okay, in any arrhythmia question, think of the mnemonic ABCD. A for adenosine, B for beta blocker, C for calcium channel blocker, and D for digoxin. The note here is adenosine has no role in treating atrial fibrillation. It comes in the management of SVT, supraventricular tachycardia, or in other words it is called as AVNRT, atrioventricular nodal reentrant tachycardia. Just remember the term SVT. Adenosine has no role in management of atrial fibrillation. So this is out. So either we can give beta blocker in this case, or a calcium channel blocker in this case, or digoxin in this case. Calcium channel blocker, if you remember, it is of 2 categories: DHP, that is dihydropyridine calcium channel blocker, and non-dihydropyridine calcium channel blocker. Anything which ends with dipin, dihydropyridine or dipin, is called dihydropyridine category. Amlodipine, nifedipine, it's a dihydropyridine. This dihydropyridine calcium channel blocker is mainly used in treating hypertension. Whereas we have 2 main non-dihydropyridine calcium channel blockers. One is verapamil, The other one is diltiazem. Okay. So we have many beta blockers, like injection form comes as esmolol. It is the very rapid acting beta blocker. Its half-life is very small. It is less than 6 minutes. We have other calcium channel blockers like metoprolol, carvedilol. We'll stop here, and D for digoxin. So we'll read the options one by one. So TE is trans-esophageal echocardiography for starting anticoagulation. Trans-esophageal echocardiography is a better investigation to pick up left atrial clots. If a left atrial clot is present, we have to anticoagulate before controlling the rhythm. Because once you control the rhythm in atrial fibrillation, whatever clot is present in the left atrium will dislodge and cause a stroke, cardioembolic stroke. That is why doing trans-esophageal echocardiography is important. But according to the question, is it the appropriate initial management? No, because anticoagulation becomes very important when atrial fibrillation is more than 48 hours of onset. Here it is clearly 2 hours, so there is no time window for anticoagulation. Also, we have to do anticoagulation when it is a valvular AF. So, valvular cases, we must give anticoagulation. When atrial fibrillation is more than 48 hours of duration, we have to give anticoagulation. In non-valvular and atrial fibrillation, we have a score called as Chad-Vask score. Okay, if you remember, C for congestive heart failure, H for hypertension, A for age more than 74, D for diabetes, S for stroke. The stroke carries 2 points, age more than 74 carries 2 points, V for any vascular abnormalities. Again, the next A stands for age between 65 to 74. The SC stands for sex category of female. So whenever you are given a case of non-valvular AF and questions comes on anticoagulation, just remember this Chad-Vask score. Age more than 74 and stroke carries 2 points, and remember that also. If the score is 0, you need not anticoagulate. When the score is 1, they say we can give aspirin or anticoagulant. When the score is more than 2, we must anticoagulate. Okay. So since this is a non-valvular AF, what is the Chad-Vask score? This is a 64 years male. So no comorbids are given in this patient. So he does not have congestive heart failure. He does not have hypertension. His age is 64. So these two categories also do not fill. Here it does not have diabetes. There's no stroke, no vascular abnormalities, and he is a male. So automatically in this case, Chad-Vask score is 0. So even if it is a non-valvular AF, there is no indication for anticoagulation. You need not actually calculate Chad-Vask in this case because the time interval is only 2 hours and it is an acute onset AF, so straight away there is no indication for anticoagulation. Cardioversion. Cardioversion is a method used to control rhythm. So it comes as the last step. Cardioversion is, or rhythm control, is of 2 types, which is chemical cardioversion or electrical cardioversion. Chemical cardioversion is by using some medicines called as amiodarone, dronidarone, ibutilide, dophytilide. Some questions can come, which is the chemical cardioverter. in atrial fibrillation. So one of these options will come, right? Electrical cardioversion is otherwise the shock. So since the question asked here is initial management, even though rhythm control comes here or cardioversion comes here, it is not the initial management. In it, every word is important. And the third one is control ventricular rate with verapamil. So this is what we discussed. The first step in atrial fibrillation management is rate control. And among the rate control agents, we have B, C and D. Beta blocker, calcium channel blocker or digoxin. And verapamil is a non-dihydropyridine calcium channel blocker. So this answer seems appropriate. Even though this seems appropriate, always we have to go through the other options. Option D is wait and watch. Of course, this is not the option because he is symptomatic, we have to manage, right? So atrial fibrillation is a very important area in NEET. So we just covered how to classify atrial fibrillation, what is